Hello, my name is Chelsea, and today we are going to be looking at the wrist. We will start off by measuring the active range of motion of wrist flexion and extension. To start, we'll have our patient seated with her feet on the floor, good posture, her elbow flexed, and her forearm resting on the table in pronation. Her hand will rest off the edge of the table so that she'll have room for active wrist flexion and extension. The stationary arm of the goniometer will be aligned along the shaft of the ulna, the axis will be along the ulnar styloid process, and the movable arm will be aligned with the base of the fifth metacarpal. Making sure to stabilize the forearm, I will then ask the patient to actively move the palm of her hand towards the floor for wrist flexion. Using the landmarks, you then measure wrist flexion. Typically, a normal measurement is about 80 degrees. For wrist extension, you will again use the same landmarks for placement of the goniometer. Making sure to stabilize the patient's forearm, have her actively raise her hand up toward the ceiling and get a measurement, making sure to align the movable arm parallel to the fifth metacarpal. 70 degrees is considered normal range of motion for wrist extension. Next, we will be doing manual muscle tests for flexor carpi radialis and flexor carpi ulnaris. We will first start by testing the strength of the flexor carpi radialis. Again, the patient may be seated or supine. In this case, we will have her seated. For the flexor carpi radialis, the patient's forearm should be in slightly less than full supination. Her arm can rest on the table or be supported by the examiner for stabilization. For manual muscle testing of the flexor carpi radialis, make sure to passively place the patient in wrist flexion and radial deviation. If she can hold this position against gravity, then she would automatically receive a score of 3 out of 5. The examiner will then apply pressure upon the thenar eminence in the direction of extension and ulnar deviation, asking the patient to hold this position against the pressure. Since I could not break her from this position while applying maximal pressure, she receives a score of 5. Now, in order to test the flexor carpi ulnaris, the patient can once again be seated or supine, this time with the forearm in full supination, either resting on the table for support or supported by the examiner. The wrists should be passively placed into wrist flexion and ulnar deviation. Once again, if the patient can hold this position against gravity, they would receive a score of 3 out of 5. The examiner then applies pressure against the hypothenar eminence of the hand in the direction of extension and radial deviation, asking the patient not to let them break them. This pressure is applied for 3 to 5 seconds. Since she could hold this position against maximal pressure, she receives a score of 5 out of 5. Next, we will perform a muscle length assessment for the wrist and finger flexors, including the flexor digitorum superficialis, flexor digitorum profundus, flexor digiti minimi, and palmaris longus. This can be tested in a supine or seated position. In this case, we will have our patient in the supine position. We are making sure that the elbow is extended, the forearm is supinated, and the wrist is in a neutral position. The therapist must make sure to stabilize the forearm while passively extending the wrist and the fingers to their limit of motion. This puts the long finger flexors on full stretch. The therapist can either observe the available passive range of motion or use a goniometer to measure the available wrist extension passive range of motion. Shortness of the wrist and finger flexors can be assumed if this measured value is lower in comparison to this patient's normal passive range of motion wrist extension values. And that concludes our assessment of the wrist. Thanks for watching.